This podcast is brought to you by the School of Advanced Study, University of London.
How's that?
Perfect.
All right.
Hi
everybody. I'm Helen. I'm also based at UCL. It's really nice to be here. Thanks very much to Michael for organising this and for inviting me. I'm a biologist, and I've worked for many years with museums. We've got our own museums at UCL. We've got 3 public museums. And I do a lot of work around the role of museums in health and how we can think about using our cultural heritage to help deliver health and wellbeing outcomes for museum audiences. And a lot of people say to me, well, why museums? Why should we be thinking about museums and our cultural heritage as a resource for helping to deliver health and wellbeing outcomes? And here's just a couple of musings about why you might think about museums and health. Here's one, for example. Lois Silverman was one of the first people to start doing research on the role of museums in health. And Chris Wood is another researcher who's done work around the role of museums and thinking about mindfulness and thinking about identity and meaning making. And this idea that essentially museums are one of the few remaining spaces that you can go and visit where you can talk about life, discuss things beyond your own life and the meaning of life. So the reason I'm interested in museums is museums are often socially engaging spaces. That's what they've been set up for, and most museums these days offer both activities within their spaces and also they go out to outreach at venues or in lots of places across the community. Museums have also got a track record in evaluating what they do and the effect of what they do on the sorts of audiences they work with. And another reason that I'm interested in museums is that a lot of them are free. Most of them in the UK are free, and there's a lot of them. So there's about over 2,000 museums in the UK alone. And already lots of those museums have very active outreach programmes. So they've got bits of their collections, like the Bloomsbury in a Box, Festival in a Box programme, taking objects out of their collections into the community to learn about the sorts of resources that they have. So with that in mind, thinking about museum outreach and thinking about the role of museums in health, we set up a research project with a series of museums, which was funded by the Arts and Humanities Research Council, thinking about the value of these sorts of activities on people's perceptions of their health and well-being. We decided to do this in the context of healthcare settings, partly because more and more museums over the past sort of 5-10 years have started to develop programmes specifically with those sorts of audiences in mind. So a lot of museums now doing work with care homes, work with older adults. We don't just do work with older adults and people with dementia, we do lots of different programmes with lots of different audiences. But those were 2 specific audiences, people in hospitals and people in care homes, that museums seem to be interested in working with. So we worked specifically around thinking about the impact of those sorts of outreach activities with audiences in those sorts of settings. So our project was set up as a research project, but evaluating the kinds of activities that museums, as a rule, carry out in outreach settings. So I'll talk a little bit about the sorts of activities in a second. And we were interested in the sorts of psychosocial effects, and I'll explain what I mean by that in a minute, both on the participants, which were mostly patients and care home residents, but also the carers that they work with and the staff. And we were very interested in thinking about the sorts of settings that we're working in, the impact that setting has, so i.e. the hospital or the care home, the different sorts of social factors, so why have people ended up there, what their clinical condition is, why they're in that particular setting. But also we're working with lots of different museum collections, so was there any difference between the different sorts of objects that museums have? And we're also very interested in thinking about the sorts of methodology around all of that. So how can we develop a good protocol for museums to work in outreach settings of this sort? This just gives you an idea of the different sorts of partners that we're working with. Lots of different healthcare and social care partners, from hospitals, as I said, through to care homes. Lots of different types of hospitals with lots of different sorts of audiences. Lots of different types of museums, from big museums like the British Museum through to small museums like Reading Museum Service. Arts Council England or Museums and Galleries Commission it was, so the sort of professional body that governs museums, and various think tanks and third sector organisations, so charities and support groups who gave us lots of support and advice as we sort of set our projects up. So because this was a research project and we were working in hospitals and care homes, the first thing we had to do was get ethics committee approval, and that really made us think hard about the sorts of methodology that we wanted to use. So how do we want to evaluate the impact of this activity on the participants? So we spent a lot of time thinking about the data collection methodology, what sort of methods to use, what would work with this sort of activity and these sorts of audiences. And in the course of the project, this was a 3-year project, finished about 2 years ago, and we worked with about 300 different participants across a whole range of settings, as you've seen. And the sorts of activities we do are, as I said, a standard sort of outreach. So if you've ever been to a museum, in a museum itself, or in an outreach setting where you've had a chance to handle museum objects, we sort of ran a standard object handling session, which is where we encourage people to explore the objects with their hands, have a tactile session, discuss the objects, think about what the objects might be, have a conversation around those objects, where they came from, what they are, what age they were, what they felt like from a tactile point of view, whether they meant anything to that person, whether they reminded them of everything. So it's a very loose conversation, but a conversation that was very much focused on the objects themselves. So I was very interested in Catherine's comments about the horse, and that was very much our experience of people working with objects. The sessions really varied in length, so most of them were about 45 minutes long. Some of them ran on to an hour and a half, 2 hours. We didn't have a predetermined time. We did have certain constrictions, particularly in the hospitals, because as you know, they're very, very busy places, and people were often had conflicting demands on their time, whether it's going off for treatments or whether it's feeding time or whatever. And a lot of the time that we spent in the build-up to this project was really thinking about the methodology side. So there's a lot of ways to think about measuring the impact of interventions on people's health and well-being. There's lots and lots of different scales already out there, quality of life scales, health perception scales, well-being scales. So we spent the first 6 months to a year trialling lots of different measures that already exist for ascertaining people's perceptions of their health and well-being. Lots of them just didn't work because of the types of settings we were working in and the type of interactions that we were engaging in. And we settled on a couple of fairly standardised and already validated scales, which you'll be very familiar with, I'm sure, already. Visual analogue scales, which is where you essentially put a cross on the scale, usually from 0 to 100. And the sorts of words that you can see here, happy, unhappy, well and unwell, really they're just measures of subjective well-being. They could be any words that you want to use. These ones are from a particular visual analogue scale that's specifically about measuring subjective well-being. So we did our scales before and after each session. Most of our sessions were one-off because of the situations we were working with. Most of them were one-to-one, so we had a facilitator, and I can talk a little bit more detail about that if you want to at a later time. Some of them were repeat sessions, and some of them were group sessions, but most of them were one-on-one, one-off, one-to-one group sessions, one-to-one sessions, not group sessions. The other sorts of quantitative scale that we looked at and used was something called the positive effect, negative effect scale. Again, as I say, this was a massive narrowing down of all the different scales that are out there to find one that would work for us. And this particular scale measures psychological well-being, and the way it works is, you can see here you've got a whole list of different adjectives, words that describe moods, and we've got a list of positive moods and a list of negative moods, and essentially people score themselves, so a bit like we've heard already, score themselves on a scale of 1 to 5 on how they feel about those particular words. So again, people would fill this in before the session and then at the end of the session. We were also, as I've mentioned, very interested in this element of the tactile component of the session, the ability to have an interactive session with a group of objects. So in order to think about what would be a suitable control in this experiment, that's a very big discussion point for this sort of intervention, measuring this sort of intervention, is what makes a suitable control. And there's lots of different ways that people have tackled this. For us, we were very interested in the tactile element of this and what was interesting about having the ability to touch these objects. So we decided in our experimental condition that everybody would get to look and feel and talk about the objects, have a tactile relationship with them. And then we developed a control condition where people weren't allowed to touch the objects and they didn't get to see the objects. We just had a photograph of the objects. That was a bit mean for those people. Unfortunately, they didn't get to see the real object, although we did then, in a follow-up session, allow them to do that. And so this really enabled us to see how much the tactile element was playing a role in this particular type of intervention. And I'm not going to talk, because I haven't got much time today, I'm not going to talk lots and lots about the statistics that came out of this, but obviously from the quantitative scales that we use, we've got lots of quantitative data. Working with over 300 participants, we've got lots of stats that we could do. This just shows you the sorts of data that we could get out of the study, and we were able to compare our experimental condition, which was the object handling session, with our control condition, where they didn't get to handle the objects. And these light blue bars here show the sort of pre-test scores. So that's the scores that they filled in before they did the object handling session, and then the darker blue squares here are after the session had finished. And so it was really thinking about what the differences were between those two scales. And what you can see here is in the experimental condition, where they got to handle the objects, that we got some statistically significant results which showed there was an increase in people's perceptions of their health and well-being compared to the control condition, which generally gave much lower scores. So people's perceptions of how they'd felt about that session was not positive in terms of the ability, when we'd remove the ability for them to be able to touch the objects. So that in itself was very interesting. We also have lots of data from lots of different cohorts of people that we worked with, because we worked, as you've seen, in lots of different settings, everything from care homes through to older adult wards, working in gynecological oncology, through to neuro rehab, so patients who've had a stroke or some sort of other cognitive impairment, in psychiatric hospitals. So we had very different cohorts and people with different prognoses that we were working with. So again, that enabled us to look at our data and see whether we had differences across different sorts of clinical settings. As I say, I'm not going to talk any more about that, but if you're interested in that, you can give me a shout at the end, and we've got lots of information on our website which I can direct you towards. The really, I suppose, interesting part for us, the quantitative side was very important to us and very interesting, but I guess the richness of the data and really understanding what it was about the sessions and what it was about interacting with cultural heritage that was interesting came really from the qualitative studies, as you've heard already from the Festival in the Box project. And for this, we recorded our sessions as well. We didn't video record them because we felt that that would be quite invasive, and also the sorts of settings we were working with, they weren't really set up for enable us to do that. So we used a voice recorder, and that enabled us to then go back, as Michael has done in their project, to transcribe those conversations and analyse them in a little bit more detail. These are the sorts of main outcomes. I won't run through all of these, but this really enabled us to think in a little bit more detail about what it is about interacting with cultural heritage in this sort of intervention that might be beneficial to people. And I won't pick up on all of these things, but particularly the idea of giving people an opportunity to talk about themselves and talk about their own identity, and also to provide an opportunity to think about making meaning out of their lives, was one of the key themes that came out for us. So the sorts of comments and conversations that people had was really about the fact that working with a person and dealing with a load of objects from a museum gave them a sort of a new perspective, and also the ability to talk about themselves and how they were feeling about their life at that particular time in a way that they hadn't been afforded that opportunity before in those particular settings. So lots of people talked about the idea that they felt that they could talk about emotions that they've not discussed before, issues, say, to do with their prognosis, their mortality, their future, concerns about their future life. And that was really something that was very interesting to us, is the ability that museum objects, as Catherine has talked about that horse, the chap really engaged with that horse, and that's really what we found, that people really engaged with the objects. Not all of them. Certain objects engaged other people more than some more than others. But it really was that opportunity that the objects afforded. And somebody's already mentioned Winnicott, and this idea that objects can afford people that opportunity to talk about emotions that they maybe don't feel they can talk about with another person. And it is that idea that sometimes an inanimate object that carries with it its own meaning enables you to talk about things that affect you in your life in a way perhaps that other people can't bring those sorts of emotions to the fore. So that's really what we've been really interested in, is exploring that dimension of having a tactile experience with objects that aren't everyday objects. We also did some control work around using everyday objects like a mug or a pen or personal objects that people had done. And again, we found quite statistically significantly different results where really the museum objects were the ones that were inspiring people to have conversations and discuss their emotions and their feelings in a way that other objects hadn't been doing in the past. So that's really what's been of interest to us in this sort of project, and really where our research is going in terms of thinking about the role of the object and thinking about that sort of multi-sensory experience for cognitive stimulations we've already heard. So I know we haven't got a lot of time today, so I thought I would, Michael said people are interested in the sort of methodology side. In following up that project, we got another grant from the AHRC. We work with a lot of different museums, and we got some money to do a nationwide survey looking at what museums are doing in terms of health and wellbeing. And as part of that, we found that museums are doing a lot already. They're doing a lot of outreach and in-reach within their own spaces. But we also asked people what sort of evaluation they were doing and how they understood about the impact of their activities on the audiences that they're working with. And the answer to that question really was most museums aren't doing that much in terms of evaluation, or the evaluation that they are doing isn't really providing them with the information that they need to be able to really understand what the impact of their activities are on their audience's health and well-being. So that led us to another project, which again was funded very kindly by the AHRC, where we decided to develop a museum-specific measure and toolkit for museums to be able to work with their audiences to gather the sorts of information they needed in order to extract health and wellbeing, or better understand health and wellbeing outcomes. And we did this really because, as you've already heard, Michael has done lots of work in thinking about what sort of methodologies to use. We'd also done a lot of work about what methodologies work. In our survey, we found that museums also had been struggling a little bit with what kind of methods work for them in the sorts of settings that they have and the sorts of activities they're running and the sorts of audiences that they're working with. So in deciding to do a cultural heritage wellbeing measure, a museum wellbeing measure, we really wanted something that was going to be very flexible, because there are lots of different museums out there, as you know, lots of different size museums, lots of different types of collections, working with lots of different audiences in lots of different geographic, socioeconomic contexts. So we wanted something that would be quite flexible that museums could use. So we set about developing a prototype toolkit which contained a series of quantitative and qualitative approaches which we've trialled with lots of different museum partners. This just gives you an idea of the different sorts of museums that we work with. As you can see, again, very different sorts of museums, from really big museums like the BM through to much smaller museums, specialist museums like the Museum of English Rural Life. So very different sorts of collections, different types of audiences, different geographic settings. And they trialled a series of prototypes of the toolkit with their audiences. We worked with about 30 museums and about 200 different participants. And the toolkit contained a whole load of different stuff. It contained some questionnaires, so based on other sorts of validated scales. So some of you might have heard of the Warwick-Edinburgh Mental Wellbeing Scale. You've already heard about the VAS, the Visual and Analog Scales. And we've done quite a lot of work around the PANAS, the Positive Effect, Negative Effect Scale. And we found that some of it was useful and some of it was quite meaningful, but statistically actually a lot of the words people either didn't understand, they didn't relate to, or they weren't able to grade themselves on because they didn't felt that the word related to their particular experience. So we binned off some of the positive and negative adjectives and came up with our own PANAS scale. And in working with our audiences, they very much felt they wanted something that wasn't a questionnaire, because everyone gets fed up of filling out millions of questionnaires. So we set about developing something that was a little bit more interactive, a little bit more aesthetically pleasing, and came up with, thanks to our audiences, something that we call the Wellbeing umbrella. People like the idea of an umbrella because it protects you from the rain or the sunshine if it's very sunny. And so we have developed a series of these umbrellas, wellbeing umbrellas, that people can use in different sorts of settings. And they're based around the sort of fundamental principles of the PANAS, positive effect, negative effect scale. And they essentially enable people to grade themselves in a more sort of fun, interactive way. Some people like colouring them in, some people like using them simply as a way to generate their own well-being words. But they essentially enabled people a route to assessing their own subjective or psychological well-being in a sort of slightly non-questionnaire based way. So we have positive ones or negative ones, so where there's positive and negative words. And there's also parts of the scale, parts of the wheel, as it used to be called, now it's called the umbrella, where people can fill out their own comments. So again, there's areas where people are able to collect qualitative data. And then along with the toolkit comes a whole series of instructions as to how to collect that data, how to analyse the data, both using sort of fairly basic quantitative and then fairly basic qualitative techniques. So the idea is that museums have a toolkit that they can start to use with their audiences, so that as a community of practitioners, museums can start collecting the same sorts of data, in the hope that as a community that is very large and is working with lots of different audiences in lots of different settings, we can start to build a stronger body of evidence about the sorts of impact that we're having on health and wellbeing, and also the sorts of activities that museums are doing, what activities work well and which ones don't work so well, and how we can improve the access programmes that museums are providing. And that's just a picture of the toolkit and where you can download it. And I think I'm running out of time, so I'm going to whiz on to the end. So if anybody's interested in finding out more, obviously give me a shout. I'm happy to have a chat with you at the end. And there's lots of information on our websites about all the stuff that we've been working on. So happy to answer any questions now or at the end. Thank you very much to Michael, and a really interesting project that you're working on. So thank you.
Thank you.